Now moving on to modes of transmission for Ebola. Ebola is a communicable disease that is spread through both direct contact and indirect contact, though indirect contact is extremely rare. An example of indirect contact would be how Ebola can be found on contaminated surfaces, but it's highly unlikely to get infected since the virus can't survive without a proper host. Moving on to direct contact, it includes direct physical contact with both humans and animals. Ebola is highly infectious with close physical contact of bodily fluids. The most contagious ones are blood, vomit, and feces. Other fluids that carried a high risk were breast milk, semen, vaginal fluid, and urine. This is the major factor in how Ebola can be spread sexually, and it was also found that Ebola can stay in these fluids from 70 to 90 days. Other fluids that carry a risk are tears and saliva, but these can only be spread from those who have a severe case of the disease. And then with the gaps of knowledge for Ebola, according to the Centers of Disease and Control, there's currently no treatment or cure for Ebola since it is a fast evolving viral disease. And due to its fast evolving nature, researchers are limited in the ability to conduct more intensive research for the disease without being exposed to the dangers, and they are also limited in finding enough evidence to prove if those who survived only survived a certain strain and if there are more infectious ones lurking. There's also minimal evidence on how long Ebola stays in the body and how long a person stays infectious. Though they do have like a period, there's no way to tell for sure. The visual on the right shows how a person could be reinfected with Ebola and how it's hard to tell if a person is completely rid of the disease. Since Ebola was only discovered in 1967, it is a fairly new disease that is both tricky and difficult to study and contain. There aren't a lot of long term studies to see the long term effects of the disease. The gaps in knowledge aren't only with the researchers. The West African population have had multiple outbreaks. This is highly due to their beliefs and lack of education of the subject. They lack proper medical care and rely on the use of traditional healers and herbalists who have minimal knowledge on the disease. While some of the medicines and rituals may work on treating the symptoms of Ebola, they don't necessarily prevent the spread. Other gaps in knowledge in the community include sanitation practices like using gloves and coats to handle the deceased, or even just the simple washing of hands.